Hey everyone, this is my lymphatic drainage video that I wanted to create for anyone who's been through surgery. In particular, this video is for top surgery. So there are lots of different types of top surgery that people can get. There's a periareolar surgery for very small chested people, which creates like scar tissue around there, around the nipple, which is really important to keep that spot really kind of like precious for a while, so you don't sort of stretch any of the scarring or the cuts around the tissue. The most common surgical procedure for top surgery is the double incision method, like the one that I've had done, which gives you these scars across your chest, and I had a nipple graft as well. And this is there's a lot of different variations of this. However, the lymphatic drainage for the chest is always the same. So I wouldn't suggest you do lymphatic drainage until minimum week 3. And I do lymphatic drainage from like week 3 to week 6, after which I'd probably switch to scar tissue massage. So remembering that at week 3 to 4 is where most of the scar tissue is being laid down. Some of the very first scar tissue is being laid down in a matrix along the cut. So no stretching, stretching, and no stretching the actual cut, especially when you do the drainage. Lymphatic drainage is meant to be extremely gentle. All we're only putting enough pressure on the area to move the skin. We're not putting pressure to massage muscles or the actual scar at all. It's literally just to move the skin. And the way you can do that yourself, like you go, oh yeah, I can move the skin with minimal pressure. That's the pressure you want to use. It's the same pressure you use to move your eyelid over your eyeball. So just be really, really conscious that you don't put too much pressure on the area. To start the lymphatic drainage, we have to activate some of the main lymph nodes. So the main lymph nodes that drain the skin of the chest sit around the diaphragm here. So you'll feel that you've got ribs, okay? Or if you stretch, you'll be able to really feel your ribs, and there's a margin where the ribs stop. Here it becomes soft. So we need to activate the area around the diaphragm. We need to activate the area underneath the collarbone. And we need to activate the area in the armpit. Okay, so I'm going to show you how to do those. We want to do those areas first before we even think about trying to flush the area. So to activate the area underneath the, around the diaphragm, I'll just try and find a really good, this is a pretty good angle. Okay, the way you do it is you've got this hard bone here, the sternum, and you get to a part of the sternum here where it starts to dip in. And so what we want to do is we want to dip in there. We use quite heavy pressure here as long as it's not painful or too swollen. And we take a breath in, breathe out. As you breathe out, you push in and down, and you sort of just go like that, like flick it off, like breathe in, pushing down and in as you breathe out, and then flicking downwards. Okay, you do that all the way along the margin. So breathing in, pushing in and down, and flick. Okay, breathe in, push in and down, and flick. And breathe in, push in and down, and flick. Okay, go to the other side from the middle all the way down, remembering that we're going like just below the hard part into the squishy part of your abdomen. So you go breathe in, breathe out, flick. Good, breathe in, breathe out, flick. Okay, breathe in, breathe out. See how I'm like pushing in as I breathe out, and then flick from there. Don't lose tension on the way down. You'll notice like you'll get a bit of redness. It might actually be quite tender because you might actually have a very tight diaphragm, in which case there's even more reason to do this. Okay, so make sure you do that first without causing too much harm to your scars. Okay, the next place you want to activate is underneath the collarbone. And for this one, you just actually use quite heavy pressure, and you want to actually rub lengthways, see that, across the muscle. And again, that might be quite sore, and that's fine. Okay, along there. All right, this is activating the area. Okay, and back. Just do that, and then do the other side. It's like you push down, and then you rub side to side. So push down, rub side to side. So this is muscular, so you have to push down quite hard and it will hurt, and that's a good thing. It means you're actually working on the area and you're actually activating the tissues underneath. Okay, and back. Okay, see how I did like 1, 2, 3, 1, 2, 3, back. All right, so that's enough to activate the area. Now you want to activate the lymph nodes in the axilla. And the way you do that, you probably can't put your arm up like that, so it doesn't matter. As long as you can get your hand underneath your pec, so like in your armpit, underneath your pec, not too hard, because this will be tender, especially if you had double incision. So you just put your hand under the pec here, and you can, if you've got a good chunk of muscle, you can just squeeze the muscle. See how you squeeze it and it flicks down? It like flicks off. That's what you want. Okay, so you can do that, flick it like that. And you want to try and get 3 areas to get right under there. Flick it. Quite painful. Other side, squeeze the muscle and flick 3 times and 3 spots. Again, flick. See how I'm getting my finger like underneath the armpit, like digging in? Not too hard, just enough to grab the muscle and flick it like that. So you want to do that on both sides. If you don't have like a chunk of muscle, totally fine. If you just get under there and you can pull up and out like that. Okay, so you're just sort of manipulating the soft tissues and sort of pulling them towards your face. Okay, in like a manner like that. Don't bruise yourself. Okay, you want to go a little bit deeper than the skin. You want to feel like either feel the fatty tissue under there or feel the muscular tissue under there and just pull it towards yourself like that. And that will be enough to activate it. So you want to go in this plane. Once you're under your armpit, you want to pull towards your face. Okay? So once you've done that, you're ready to deal with the soft tissues around the scar. The whole idea of lymphatic drainage is to remove extra swelling around the scar and allow for new blood to flow into the area. When you get new blood flowing into an area that's healing, you can optimize the healing because you're getting new blood cells, you're getting new types of cells flowing to the area, lots more nutrients, and so it's more likely to becomes less stagnant and less toxic, the area. So then it like heals a bit better. There's more oxygen, the better it heals. So for this, you want to get something like this kind of gel. This is my favorite go-to gel. It goes that way. Renew 28. It's really nice. Doesn't dry anything out. It doesn't moisturize anything. So it's really good for tissues, cuts and scars. And it's just really just got these great molecules in it, these redox molecules that help the area heal. So I really like this because it's not going to affect or infect or like any of the tissues that are open. So, and it's very gentle, it's very easy. So you can use this, I would use this or a silicone-based gel. I wouldn't be using any oils right now, no moisturizing creams, nothing like that. We want to probably bring those in once the area is completely sealed up. We don't want to make it moist and we don't want to bring an infection to the area. Bacteria loves moisture. So if we make the area really wet and moist and creamy, more likely to help the bacteria that's in there proliferate. We do not want an infection in the scars. So with this one, with this or your silicone-based gel, all you do is get a tiny bit and you just rub it along the bottom, all the way along the bottom of the scar. Okay, just like so it's on the skin. And then you want to be using the opposite hand to the area you're going with. And you want to start centrally and you want to push like this. Just again, the skin. You can see my skin changing, but I can't feel it in my muscles. Okay, you just want to do that. So you're sort of going along the swelling and then down. Along the swelling and then down. Be careful not to pull the scar apart. Along the swelling and down. Along the swelling and down. And try and get up into your armpit. If you've got ones up here, you probably can't push that way, but you can actually pull and come down. You can pull and come down like that. Okay, so that's what you want to do to the lower part. Just push and come down, push, come down, push, come down. That's going to get the liquid or the swelling that's underneath those subcutaneous tissues to start flushing through the lymphatic system. And because we've activated this and this and this, the lymph nodes are going to be more active and they're going to suck it up for you. So when you do the top, be super careful, especially if you've got nipple grafts and all that kind of stuff. We just don't want to pull tissue apart. or deform nipples. We want to just keep everything where it is at, which is why we use such light pressure. Okay, so we put the gel on around here. I usually go up a little bit more on the chest, okay, and around here. Okay, so you covered the whole thing, and you start at the sternum here. So we push in and up. Okay, you can come up the sternum a bit, it's not a bad idea, because you've got a cut there, the normal flow of the fluids to the lymphatic system is altered. So all we're doing is we're kind of manipulating the flow. We're encouraging it to go back to its deeper vessels to actually drain properly. Okay, so we come along the scar tissue and come up, come along the scar tissue and up. Just be really careful of the nipple and up. And with this bit, it's really tricky because if you are fresh, the nipple, between the nipple and the scar hurts. So just don't go under there. But just start here and pull up towards your armpit. Up towards your armpit. Up towards your armpit. So yeah, it's just very light pressure. It's just enough to move the skin, and that's all you need. Because the fluid's in the skin. The fluid's in like the subcutaneous areas. So, okay, just finish with a few sweeping motions over your pec. Okay, and you can go back to this area. So most of the swelling that you'll feel, it'll be like a few centimeters either side of the scar. So you just pull it up like that. Just try not to open the scar too much. Just be really gentle. Okay, just those sweeping motions. And then you obviously use your other hand on the other side. Cool. If you have any issues, feel free, just direct message me on Instagram or leave a comment on my YouTube and I'll get back to you ASAP. Cool.